awareness of research methodology is very important for a clinician. In the recent years, we have been shifting from eminence based, meaning boss ने जो कह दिया सो कह दिया and we have to abide by that, to evidence based medicine, where we try to collect evidence for a outcome and our decisions are based on that. So we may not necessarily be active doers of research. Some people may think कि हम तो research करते नहीं तो हमसे क्या मतलब, पर ऐसा नहीं है. We are indirectly also contributing to research by having accurate documentation of our data. And all of us are users of research. We go through research papers and we base our decisions on the observations of other researchers, which we must know how much weightage to give to a particular research paper and its conclusions. So we have to actually look into the methodology that has been used. Now, what is essential for any research is a research question. And where does a research question come from? A research question comes from a curious, inquisitive mind. And that is the essence of what I always try to tell my postgraduates, that you must be observing and questioning everything that you see in the hospital, in the wards, in the OT, in the pre-op rooms. Often I have seen that a resident or is posted in the pre-operative room. He has seen whatever procedure is being done, and when he comes back, I ask him, what did you see? Ma'am, they were preparing the patient. How were they preparing? No answer. What drugs did they give? No answer. What percentage of which drugs were injected? No answer. So this is what I want to tell everybody, particularly my students, that whatever you see in the ward, see it with a curiosity and an inquisitiveness, and always ask what is being done, why it is being done, and are there any other methods to do it. Now, as I said, data is important, and data can be of two types: quantitative, where there is numerical information in terms, let us say, intraocular pressure, the angle of deviation, the blood pressure, the age of the patient, and qualitative data may be sex of the patient, right? Or maybe good, bad, or poor, or pain may be severe or mild. So that is kind of data is called a qualitative data, and we must be aware of what type of data we are wanting to collect. The next thing is, what are the possible events of interest for a clinician? So we are dealing with patients. That means a person who is having some disease. And also we are dealing with normals who come for routine checkups. Our interest is what caused this disease? What is the natural course or complications of this particular disease? What is the effect of interventions that we do? The interventions may be surgical, they may be medical, and the effect or the natural outcome may be that the diseased person gets cured and goes to the category of normal, or there is some residual disability or morbidity, or there is blindness. In ophthalmology, the worst outcome is blindness. Fortunately, in our specialty, death is a very unusual outcome, but there are other diseases for which, if the study is going on, the death may be an outcome. Now, what is a good research question? A good research question narrows down a broad topic of interest into a specific area for a study. It has a domino effect on the rest of the study, defines the boundaries of the study, it influences the research methodology, sample size, data collection, and data analysis that we will be doing on the data that we have collected. Or the other person who has done that also we should be capable of analyzing and finding out how much weightage to be given to what conclusion. The research questions also can be quantitative in nature, for example, amount of refractive error in children 2 to 15 years, duration of disease and IOP in patients with advanced glaucoma, or qualitative in terms of poor, good, high or low, effect of refractive error on social interaction. You know, how do people with advanced glaucoma perceive other people's reactions to their changed conditions? Or our interest, area of interest may be wanting answers both in a quantitative way and in a qualitative way. So we have to be very clear as to what we are looking for, and then look for it either in already done research or in our own research. Let us have a look at some examples of bad and good research questions. I hope I have people with me and will try to answer for themselves whether a research question is good or bad and why it is so. Let us look at the first question. How does social media affect people's behavior? Is this a good question or a bad question? This is a bad research question. Why it is so, we will talk about later. Now, how about this one? What effect does more than 6 hours daily use of YouTube for 6 months have on the attention span of children under 16 years? Now, this is a good research question. Now, let us look at the comments. The first research question is considered bad because of the vagueness of the social media, because of the vagueness of the people who we are going to study, right? And the second question is telling us clearly which age group children are we going to use, which people, which media, we are trying to study for how many hours. So that makes it clear for us when we are collecting data whom to study. Otherwise everything becomes vague, and once the data is vague, analysis to fir Rami jaane. Now let us look at the second example. Has there been an increase in childhood obesity in the past 10 years? Now this again is a bad question. Bad research question. How about this? How have school intervention programs and parental education levels affected the rate of childhood obesity among 1st to 6th grade students? Now, you see, this is a good question because it is defining us the age group, the patients that we are interested. It is also defining what are the interventions that we are trying to study, and it is not vague. Now, if you look at the comments, the first research question is not ideal because it is too simple. It can just be answered by simple observation and a yes and no. A research question requires a collection of data, analysis of data, and of course a good research question to begin with, and then a analysis of data, and the conclusions are drawn from analysis of that data. So these are some examples, and you can have so many examples for yourself, and whenever you are trying to make a research question for your own research or your students' research, or you are trying to look for an answer to a problem in the already done research. Always make sure that the research question that you have in mind is clear. It has the population that has to be studied. It has to have the intervention that you are wanting to study. It has to also have the outcome of interest that you are wanting to study. Now, ophthalmology, we have one advantage, that we have two eyes, and you should never miss an opportunity to use the other eye of the same patient as control. This takes care of many confounding factors that may have effect on the outcome. For example, if you are studying, let us say, outcome of diabetic retinopathy or some intervention of diabetic retinopathy, then many diabetics may be having hypertension along with them. They may be having obesity along with it. Some may be having hypertension also. And though we are studying diabetes, there are these other confounding factors which are affecting the diabetics more than the non-diabetics. So it is a good idea to never miss an opportunity whenever you can to use the other eye of the same patient as control. Let us now have a look at the levels of evidence that the various study designs provide. Looking at this pyramid, we see that meta-analysis and systematic reviews are at the top, and they provide the highest level of evidence. There is a mild difference between these two, which I am not going to cover up in this small talk. Then next is the randomized controlled trials, then the cohort studies, next is the case control studies, then case series, then a case report, and then the expert opinion. Now, I do not mean to say that an expert opinion has no value. It is of value, it is supported by a lot of experience, but we must also remember that it is not supported by documented data. So we respect the opinion of our seniors and experts, but we can try to prove it by further research, retrospective or prospective. But as far as the levels of evidence in study designs is concerned, that is the order in which we seek for the level of evidence. So, thank you very much, and I hope that as a result of this small talk of mine, I will have many inquisitive minds who would question, develop research questions, and take research in ophthalmology forwards. Thank you very much for your patient hearing.